Hey everyone, I'm Dr. Sebastian Gonzalez from Performance Place. Today's a little bit different video, and it's focusing more of a personal account of what happened to me when I actually got hurt with an oblique strain. I've never had an oblique strain before, and I don't see too many people or patients with it. So I always think it's very interesting to get these types of injuries. I'm athletic, I'm 30 plus, so finding these things or getting these injuries, like, it really freaks me out even. Like, I get set into more of like patient mode, I call it. I start getting a little emotional about it, I get paranoid, I kind of lose train of thought of what logically is going to make sense because it's more important to you. So anyways, I had an oblique strain. It was right around the side here. I still play baseball, I still lift, I still run, and it was amazing to see that this injury, I thought I had done everything over the winter time to be able to train very effectively for baseball and being able to hit more for power and so on. And one thing I had forgotten to do was a lot of rotational and a lateral motion, even like fine stuff. I was doing more powerlifting and so on. But anyways, today's going to be more of a personal account of kind of how this happened to me, and you guys can learn through that. So what happened was, or I'll tell you first how it felt, and the things that really hurt with it. I mean, it was sneezing, it was coughing, sitting down, getting in the car, twisting, rolling over in bed. I remember thinking, I wonder how I'm going to be able to work the next day and work on people if I can't, like brace or anything. It was even going to the restroom was painful. I mean, the thing that I was most paranoid about, period, was that if I sneezed, I mean, getting around cats or like pollen, like I have those allergies, and to sneeze, I would have to just hold my hands right here as hard as I could and sneeze and not let it out. And I remember that it felt like my intestines were coming out. I was almost doubling over in pain. Within about probably 2 weeks, like, a lot of that went away. But for that point, I had to go on a plane and go out of town, and I was scared to death of getting sick on the plane. And if you know me well, getting on a plane, I usually sanitize the seats and stuff because I want to make sure. I got to think about public transportation in regards to germs and so on. Out in the public, I'm fine, but anyways, in that, gets me a little freaked out. So I sanitized the heck out of it. I almost put a mask on because I was really freaked out. If I got sick and I started sneezing and coughing, that would be the end of me. I'd rather just go on morphine drip and just lay in a coma for 2 weeks. So anyways, those are the things that hurt. How it happened to me was I was playing baseball. I remember in the first inning, there was a ball that was hit directly over my head, and I play outfield. So I had to reach up and catch the ball, so basically overstretching this side, and I landed, and I felt a little twinge kind of in this area, and I didn't think much about it. It was a 9-inning game, so basically a couple times I had to round the bases, going for third or for home and so on, so I was running hard, and I started feeling a little pull right here. So I was starting to become a little bit aware of it, but it wasn't hurting. It just felt almost, if you're really in tune with your body, you can feel when things aren't perfectly normal. It's not like it hurts, it's not like it's aching or anything, it just feels like it's different. So around the 7th, 8th inning, I was at bat and I swang and missed, and it was that rotational pulling effect here that, I mean, I could feel it, I heard it pop. And immediately I looked over at the guy on deck, and I was panicking. He's like, "What, are you okay?" And I'm like, "Yeah, I'm okay." But I basically had to bun out the rest of that at-bat. I couldn't play the field after that, and I was just laying on the side just trying to breathe and brace and stabilize this area and thinking, what can I possibly do to make this better? And it even hurt to look up and watch people make a play on the field. So anyways, going through this stuff, I'm starting to learn a little bit more about the functionality of the core and how important it is for all these different things. Because like I said, all those things really, really hurt when I was doing them. So my goal here with this video is to show you guys from a sports medicine standpoint and from an educational standpoint how you can help out with if you have a condition like this. Because I finally took a step back and looked at it from the logical side. What would I do if I was a provider with a patient like this? And I can also see from the other side, since I was a patient, I can see how paranoid and freaked out I was about doing different things. Now, there's lots more information that you can go through on. I wrote an article on this, and I'm just kind of going verbatim or kind of unscripted right here. But in the article, there's more about timelines of things, like after 5 days you can do X, Y, and Z, within 2 weeks or 3 weeks or so on. This is the methodology of what I thought. I don't want to go into the specifics of that on this video, but I'll tell you about at least my first gym experience. It was a few weeks after, and I went in and I was standing in the gym just thinking. It was actually in a CrossFit gym, and I wasn't even going to do the class. I was just going to lift, and I thought, what can I possibly do in here that won't hurt? And I didn't even know what, because like I said before, it hurt to bend over and stuff, and bracing and sneezing, and so breathing hard would hurt, right? So what I first tried was I tried rowing. I tried barbell hip thrusters, Bulgarian split squats, and all these were fine. I eventually went into front squatting. I didn't want to go to deadlifting right away, just because bracing or lack of control and stabilization in the core area can lead to disc injuries and so on, or basically a worse injury. But that was the mentality I had. I got into the gym, I tried a few things, I did very lightweight, and I increased the weight very slowly, and just thinking systematically, if this hurts, then I'll stop and I won't do it again. If this hurts, or if this doesn't hurt, then I'm going to keep doing this, and I'll increase the weight on a little bit, and so on. Because sometimes the hardest thing is just getting back in the gym and not being afraid of what your injury is, because I was deathly afraid of it too. So anyways, I'm doing very well right now. This is at least 8-9 weeks after the fact. You can check my Instagram feed. It's PerformanceHB, or at PerformanceHB. You'll see some pictures of how I tape things up and so on. I had to tape and restrict motion in the area just because it was so painful to even bend to the side or extend and rotate. So you can see pictures of the taping job, which I did that same week again. And about like nine weeks now, I think. So I was able to play quite a few games, and I'm feeling pretty good. Still timid. I actually played yesterday, and I was timid about missing the ball and really extending far with the bat. So I thought about oppoing, going opposite field. So just to let you know, these things do take a little bit of time. Don't panic. Read the article. If you have any questions, feel free to contact me about it. I'll answer them as best I can, at least in regards to my experience about it. I can't fully tell you what to do with your oblique strain or your condition, just because our medical professionals are kind of governed by this law that says we can't give advice over the phone, over the internet, and so on if we haven't really examined you, because we don't know if you actually have the condition you think you have. So anyways, I hope this helps you guys out. Again, I don't have any studies or anything to base any of the stuff I'm talking about today on, just because this is a personal account. Logically, how I went through an oblique strain and how I came out thinking, at first I thought, this is the end, I'm not going to be able to play baseball anymore. But I'm playing again, so I'm very satisfied with that. So hope it helps you guys out. I'll talk to you soon.